All right, Dr. J here again. Not my best view, but for your students, I'll do anything. All right, this is next in the series on blood vessels. Today we're going to be talking about the blood vessels of the gut. They can be pretty challenging, so I like to break it down on the board, and that's what I'm going to do in lab, but if you want to have extra study time, here you go. So when covering the blood vessels on the human models, I talked about for the gut in the arteries, there are 5 branches, 5 arterial branches coming off of the abdominal aorta, the descending abdominal aorta. In order, the first branch coming off the descending abdominal aorta is the celiac trunk. Now, when we talk about the abdomen, we mean that it's underneath the diaphragm. So this is supposed to be the diaphragm, okay? So when we get underneath the diaphragm, we identify the descending abdominal aorta. Coming off of it, the highest branch is the celiac trunk. Just memorize it in order. Highest branch, celiac trunk. The next branch down is the superior mesenteric or mesentery artery. The third branch down is the renal. You'll know it's renal because it's going to the kidneys, like my little kidneys there. The fourth branch down is the gonadal, going toward the gonads. And the most inferior branch is going to be the inferior mesenteric artery. So memorize them in order. The highest branch coming off of the descending abdominal aorta, celiac trunk. Next one, superior mesenteric artery. Renal artery, gonadal artery, inferior mesenteric artery. Just memorize it, memorize it, memorize it. Arteries. Celiac trunk, superior mesenteric, renal, gonadal, inferior mesenteric. All right? There are 3 branches coming off the celiac trunk. It's called a trunk because there's 3 branches coming off of it. These branches are named for what organs they go to. So one of those branches is the common hepatic that goes to the liver on the right side. Another branch is the left gastric. You'll see on the model it goes to the stomach. And the last one is the splenic, goes to the spleen. For the remaining branches off the descending abdominal aorta, I put in black here what they supply, right? So the superior mesenteric artery, or superior mesentery artery, that supplies the small and large intestine with blood. The renal, no surprise, supplies the kidneys. The gonadal supplies the gonads. And this one's a little tricky, it's very specific. The inferior mesenteric artery supplies only the very distal end of the large intestine. 5 branches coming off the descending abdominal aorta for arteries. Now, if we go to veins, okay, you can see I have these in blue because we're talking about veins. Coming off of the inferior vena cava are only 3 direct branches. The highest branch is the hepatic, goes to the liver. Next one is the renal, goes to the kidneys. That's a pretty bad kidney. And this is the gonadal. So just memorize for the veins, only 3 branches coming directly off of the inferior vena cava. Hepatic, renal, gonadal. Hepatic, renal, gonadal. Now we can't leave it that easy for the veins because it's not that easy. So we're going to talk about the hepatic portal system. So I've got a nice drawing here. I apologize for the sun, but we'll do our best here. The hepatic portal system includes the hepatic portal vein. Let's break it down as best we can. We already talked about the hepatic vein. The hepatic vein is the vein that drains from the liver directly into the inferior vena cava. But it's not that easy. We also have a vessel called the hepatic portal vein. I put it in green, even though it is in fact a vein, so it is carrying blood that's deoxygenated back towards the heart. But I put it in green so it would stand out from the rest of the blue veins here. So, to review, the hepatic vein simply drains blood from the liver to the inferior vena cava back to the heart. The hepatic portal vein is a portal. The hepatic portal vein transports blood from the liver to the other GI organs. The hepatic portal vein transports blood from the liver, or I should say rather in order, the hepatic portal vein transports blood from the GI organs back to the liver. Now, we mentioned in the arteries there was a superior mesenteric artery inferior mesenteric artery, gastric, all those things, well, they exist for veins too. They just don't directly go back to the inferior vena cava. They're a part of the hepatic portal system. So I've shown you that here, okay? The hepatic portal vein is a portal from all the other veins. So we've got a vein coming from the spleen, splenic. We've got a vein coming from the stomach, gastric. We've got veins coming from the large intestine. What vein comes from the distal large intestine? You got it, inferior mesenteric vein. Well, these branches from the stomach, spleen, intestines don't go directly to the inferior vena cava. Instead, all these other veins go to the hepatic portal vein, which transports it to the liver. And then from the liver back to the inferior vena cava is the hepatic vein. All right, good luck studying.